A very good afternoon, all. Let me take this opportunity to introduce Shalaka ma'am. Ms. Shalaka Pranab is Assistant Nursing Superintendent of Nanavati Hospital, Mumbai. Over to you, ma'am.
Good afternoon, everyone. To thank the Astron and the attenders especially that they are given me this opportunity to talk. Okay, so we will start with the assessment of neonate and pediatric patients. First of all, I want to tell that is, that assessment is a key component of nursing practice. You all are aware about this. Yes? So,
Yes, ma'am.
What is a pediatric nursing? It is the first step of nursing process. Patient assessment is the foundation of any plan of care. And in the nursing process, we are having the assessment, then your diagnosis, then your planning, implementation, and your evaluation. Again, the evaluation, it will turn to the assessment. So the assessment is a main aspect. It is, that deliberated and systemic collections of the data and determine the patient's current and the past status, functional status of the patient and the child, and then determines the patient present and past coping patterns. So when you are assessing any child, you have to remember that is you have to first collect the history of the patient or history of the child. Child is your client. Yes, we call it as a client. So when you are collecting the history, you can collect the history in the form of subjective data and the objective data. Yes. So as you have completed the GNM and BSc, so no need to explain about the subjective and objective data because you are aware about that. Especially the subjective data is a demographic information about the patient and the family and past and the current medical history. So that we call as a subjective data. Objective data is a gathered information during your physical assessment. Then your nursing process will start. Now, when we are dealing the pediatric client, that time the physical development, cognitive development, these are the points coming under the growth and development. Because every neonate, it will grow, they will develop physically, physiologically, cognitively, that is your thinking skill, then your language development, your social and emotional developments. Okay. Then the milestones are the things a child can do by a certain age. So we know that is the stages of the growth and development of the patient or your child. So the child will grow, they will have the growth and development according to the stages. That is from birth to 1 year we call as infancy, 2 to 3 years we call as early childhood, preschooler is between the 3 to 5 years, school age 6 to 11 years, and adolescent is 12 to 18. Then we will see the pediatric assessment. I told you that is newborn is after birth to 28 days. But after that, there, the infancy period will start, preschooler, schooler, then the adolescent. Okay. But when you are assessing the pediatric client, that time ABC it has to be kept in your mind. A for appearance, B for breathing, and C for circulation.
Thank you very much, ma'am, for your valuable suggestion and the information shared with the student. Thanks for your time also, ma'am.
Thank you, sir.